very transparent and very aesthetically appealing, they have gained immense popularity for able to move the teeth or to correct the malalignments in the desired positions. So the journey from this conventional metal brackets to this aligners marks a paradigm shift in the field of our orthodontics. So offering a more aesthetically appealing results and most aesthetically appealing lifestyle friendly option to the patients. So this clear aligners, is it a boon or bane to the patients? Definitely the patients who are deterred in taking orthodontic treatment because of the visibility of metal brackets, it is definitely a boon to the orthodontic patients, and it is more aesthetic. It marks a lesser appointments, and also it is very comfortable, ease in removal and wearing, and the oral hygiene maintenance is also good. So initially these were used in treating a mild cases like a spacing and a mild crowding, but nowadays it's been continuously evolving in treating a very vast variety of cases, which includes bicuspid extractions and more specifically the distalization effects in both maxillary and mandibular arches. So let's have a comprehensive look about how these aligners have been evolved in this field of orthodontics. So it all started way back in the year of 1924, where the Remel Snyder has given a tooth massaging device. This tooth massaging device is nothing but it's called a flex O-tight appliance, which is given in the periodontal patients for stimulating of gingiva and gums in the actoperiodontitis cases. And incidentally, he has observed a slight amount of tooth movement which has happened with the help of that appliances. So with this concept, the Kesslings in 1945 has made an appliance, but he used a rubber material to see whether this tooth movements have been actually happening. And to his surprise, there was a mesiodistal and buccolingual tooth movement has been occurred in that appliance. But the major drawback is, since he used a rubber material, there was a very bad taste of rubber in the oral cavity. So to further improvise it, in the 1964, Nahum has used a different materials like vinyl acetates, polyethylene and PETG and all those materials, and he has also observed the tooth movements which has been occurring. Again in 1993, Sheridan's has given the Essex retainer, so what we commonly use even nowadays for the retention of the orthodontic treatment. So he has also observed there is a slight tooth movement has been happening in the Essex retainer as well. But however, creating the appliance required a production of an impressions at each subsequent appointment. So that becomes the cumbersome procedure in whatever they have invented or whatever they have identified till now. Hence, the clear aligners have evolved into this field. So basically, these clear aligners have been categorized into 3 generations. The first generation was evolved way back in 1990s without any auxiliaries, that is, there is no attachments have been placed. Whereas in second generation, they have used a composite buttons or otherwise called as an attachments. What we can see, the bumps on the a tiny small bumps on the aligner surface, which I'll explain in future slides. And the third generation or the indentations that gets accurately adapt to the contour of the tooth surface. So a little bit history about the Invisalign. So this company and the technique was the brainchild of these two MBA graduates at Stanford University, which is a Kelsey Wirth and Zia Sisti. So this guy, Wirth had his traditional braces in his high school, whereas the Sisti has finished adult treatment with traditional braces and had a clear plastic retainer. So he noticed that if he is not wearing his retainer, the teeth tend to move. But when he is going to put his aligners back, the teeth will swiftly move to the desired position. So they have applied this 3D computer imaging graphics, and they have invented this Align technology and this Invisalign method. So Invisalign, it's a proprietary orthodontic technique that uses a series of computer generated custom plastic trays. It's a both brand name as well as the technique name, and it's been commercially available to the orthodontist since 1997, and it's been available to all the since recently. So aligners have evolved immensely since their introduction, and also it has been continuously modifying based on their material properties and based on the method of fabrications and the attachments. So with the introduction of Invisalign, they have also used several auxiliary components like a composite buttons, the first image, which is used for the purpose of engaging the intermaxillary elastics. Like in our conventional method where we will give an intermaxillary elastics for a class 2 or class 3 malocclusion correction, we can also depict the same kind of treatment using an Invisalign. So the Invisalign trays are transparent, aesthetic one. So they have given a composite buttons or aesthetic buttons for the engagement of elastics. So for the best results, each series of trays or wands sequentially for 1 to 2 weeks, especially 10 days is recommended, and each tray will achieve a tooth movement of 0.2 to 0.3 millimeters. So how this clear aligner therapy works? So it basically depends on two things. One is space management and the application of pressure. Space management, the bread butter jam in the clear aligner system is IPR. So they utilize a IPR, that is interproximal reduction, especially 0.3 millimeters, that is 0.3 to 0.5 millimeters of IPR in anteriors, which is the recommended, 0.5 to 0.6 millimeters of IPR in the posterior region. In some cases, we also opt for an expansion. And in some cases, we will go for an extraction of the teeth also. So, with the help of an aligner, extracting 2 premolars, extracting all 4 premolars, extracting the 8s, upper 8s for the distalization has also been possible with the clear aligners. And the second principle is it depends on the application of force. So, this application of force is mainly determined by the attachments, where we are going to place the attachments onto the tooth surface. So it is going to exert some kind of pressure.
Projection.